Right. Well, I'm Andra. For those who don't know me, I'm a BA out in Utah. Today, we're going to chat a little bit about fade and how we kind of made that decision for one of my clients. I think this is really important to share with everybody because it's never a fun conversation, but it's something that has to happen in this field. So I have he's 12. He has multiple diagnoses, which I'll talk about in a little bit, which played into this fade. He'd been in services or fading still. So he is in services, has been in services for about 6 years. When I took this case, we had kind of reached like a halting point almost. There wasn't a ton of progress being made. I consulted with other BAs, my supervisor, talked to them. I was just like, I don't really think there's much we can do for this guy anymore. That being said, a lot of the things parents wanted to work on were speech related, AAC device related. It was pretty tricky because this parent, to be entirely fair, I was totally scared to bring up this conversation with her, which I think we all are when that happens. But I was pleasantly surprised that the parent actually was like, yeah, that makes total sense. I'm totally in agreement. At that point, I really brought up like the clinical necessity progress. I went through with this parent and showed his graphs and just showed he was very cyclical in regression. Everything was super low levels to super high. There was never a trend. I mean, I really talked about the medical playing into that and his cerebral palsy with behaviors and stuff like that. There's a really large medical component that we couldn't control. So really looking at this kid as a whole instead of just being like looking at these graphs. Well, there's no progress. I don't think we can do anything else. Really dug back into his program book, looked at what had worked, looked at what was tried previously, and then took into account these medical issues that were playing in, and ultimately made that decision that ABA is just not the right treatment for him. I think it was also really important that I had talked to mom that, maybe we get him hooked up with more intensive speech therapy, more intensive OT, and in a couple of years, maybe he is at a baseline place where he could come back and we could make some significant progress just to give that, we're not giving up, but this is not working right now. Just as a professional myself, I really don't personally believe in holding kids in therapy for these super extended periods of time, especially when they're becoming teenagers and they want to have a life. And, there's camps, there's DSPD, there's all these other things instead of sitting in therapy for 3, 4 hours a day after school and making no progress. So that's just a belief I hold as a practitioner, which I think also really helped guide this because I was like, hey, let's give your dude his life back instead of, you know, making everybody feel terrible when we have to do the Vineland every 6 months and you're not seeing any progress. We're not seeing progress day to day. We faced a little bit of kickback when the fade started. I think parent had just become very accustomed to having someone in their house. So we really worked with that. We're like, okay, we can be flexible up until this date, and then the BT started fading onto another team. So we kind of ebbed and flowed just to make sure the parents stayed comfortable and it wasn't like, oh, ending ABA was this horrible experience. I've put in a lot of effort to go to all doctor's appointments, speech, OT, just to help make this transition really smooth. Getting documents together. I edited our VSPs for DSPD. But yeah, just trying to be as upbeat about it as possible. I know a lot of parents, kids will reach discharge and it's not necessarily graduation, like whoop-de-doo, it's not what everybody hoped for. So just continuing to stay upbeat instead of like, oh yeah, you didn't see totally what you wanted to, but really making sure we're here, we're still a lifeline. We're not just going to drop you off and be like, goodbye, have fun.
I think you bring up some very powerful stuff here. I was thinking, Andra, about what it's like as a clinician when you realize my child I'm working with is not responding to treatment, and what are kind of some of those steps that you went through to decide now is a time that we need to fade? Like what we know sometimes in a period of time you're saying like there's no response here. Maybe I need to try
Mhm.
something different. What are some of those things that you did along the way that kind of helped solidify your decision?
Yeah, so I looked at all of his treatment goals that he has had in his whole time with the company, and a lot of it was very, basic level things that physically he was not able to do, such as even track his AAC device with his
Mhm.
vision. And then looking at, using a pointer finger was super hard. So we looked into eye gaze on his device to see if that was something
Mhm.
different. We reworked his device in a way that everything was super high contrast. We made the pictures bigger to really try to kind of even the playing field for him. And then it was also a difficult discussion with parents to talk about what is feasible right now. We talked about they had some really, really big goals for their child that just weren't at this point in time for him were not the priority. Like they wanted him to brush his teeth and get dressed on his own. And I was like, okay, let's look at what's happening day to day.
Mhm.
He's having these really high behaviors. So it was really a back and forth conversation about what is happening right now versus where do we want to be in, weeks, months, years, and just looking at how can we make that as adaptive as possible. And then I know I touched on time and treatment. I'm not saying longer times and treatments don't work for people, but when we're looking at this friend, time and treatment with such minimal or really variable progress was one of those things too that I was like, we've tried a lot. We've modified these programs, we've changed prompt levels, and it's just not sticking.
When that happens, you find out that actually they just needed to learn differently, right? So it's
Mhm.
not just, well, I tried the traditional way that works for the majority. It didn't work, so we're ready to transition. No, sometimes it is being really creative. It sounds like you were very systematic in how you went through those things and systematically tried them, and you saw we're still in the same place. Now
Mhm.
we need to really look at the now. I know our goals are here, long-term goals, which is great to have, but what are those steps now that are going to help day in, day out? And it sounds like you were able to really connect with that parent and help them understand that we need to really focus on the now, what he needs today.
Yeah.
Yeah.
I did collaborate with OT, have had some conversation with school, waiting for speech to come up next week, but we kind of talked about we all had kind of the same goals and talked about how did you change these or did we scrap them? What did you find? And really trying to make this cohesive across every environment. A lot of the things was with this device and us not being able to track the device was kind of a, not sure what we can do. Family wasn't super open to PECs. They had tried PECs. There was just a lot of other variables on top of this medical and the little progress that played into this decision.
Yeah, I had a very similar situation, Andrea, with a kiddo that I think we even had a conversation after some of our VA meetings that we had to start discussing a fade, but very similar, also had a diagnosis of cerebral palsy as well, and had been in like kind of a legacy patient kind of situation where he had been in for like 7 years. And he's a little older though. He's in high school now, but um, yeah, and what I ran into a lot with my clinical decision to start fading was the fact that we couldn't even do more than like 7.5 hours. So he was basically already in a fade plan. Like, and that's something that I had to kind of talk to parents about too, is like, hey, you know, ABA is meant to be an intensive treatment, and it's not even your son's fault. Like he's literally just falling asleep like at the end of session because he's had such a long day, you know. But that's where it was like, let's get him in extracurricular activities that he really enjoys, or extra speech, or extra, things like that, or let him have the extra sleep that he needs. And I love that phrase of like, give him his life back kind of thing, because I do think that as wonderful and helpful as ABA is for so many of our kiddos, when we stop seeing a lot of that progress, it is a really intensive, like, they are sticking with it for a really long time, that, give them that opportunity to have, a typical growing up life, and give him those opportunities to access, again, those extracurricular activities that maybe they're not getting to access because they're in ABA. And so, yeah, I definitely have had similar experiences. And yeah, Andra has been so helpful in that process as well, because I was really nervous to bring that up. I think especially with the people that have been in for a really long time, it's always a little bit, again, they get used to having somebody at their house. And yeah, Andra has been a really good help, and other supervisors and everything as well, and kind of transitioning. But I think that that's kind of a universal feeling when you're going into a fade that isn't necessarily the graduation celebration kind, where it's like totally, I think, normal to have a lot of anxiety going into those conversations, because I do think that it is a difficult clinical decision to make. So that's just a thought that I had.
Do you think there's anything that we can do to help prepare families earlier? I mean, I know we're trying to get parents to commit to treatment, but at the same time, while you're doing that, also help prepare them that we're not going to be here forever.
Yeah, I mean, I think I've seen success, especially with the kids that I've gotten like initial assessment, like from the get-go. I've had conversations from the beginning of like, ABA is not meant to be a lifelong thing. Like, and even explaining ABA is an intensive treatment. And sometimes that helps parents commit to the hours a lot more, is because they're like, okay, this isn't forever. I can do 30 hours this week, or like whatever for the next 6 months. And then we can start, seeing how reducing hours and everything. But I think I've had a lot of conversations, and even kind of telling them, I think in parent meetings, showing them graphs and showing them data and showing them progress is so helpful, because then you can be like, yeah, this is what, oh, they are mastering all these things. That's awesome. That relates to where they're, closing those gaps, developmental gaps. And that's when we want to see us fading hours, or vice versa of, hey, we're not seeing progress. We're going to try this other thing, see if that works. But, we want to make sure that we're ethically billing insurance, that we're actually seeing like progress. And this is actually a treatment that works, an effective treatment for this kiddo. And I think both of those kinds of conversations, I think the more rapport that you have with parents and the more that you're able to meet with them and discuss things, I think the easier it is to go into those conversations that are a little bit more tricky. We're really happy, if it is fading hours and it's a celebration, then that's also great. But sometimes I even have parents that don't want to, even if their kid is making all this progress, they're like, no, we want to keep ABA, like he's not ready yet, and that's when I think the parent training is really important to come in to play as well for those situations.
I think from the outset, even with just the way I do things, when I get transfer kids or the kids I've had from the beginning, it's a conversation we continue to have. It's not one that we have and then goes away, and then a year or two, oh yeah, remember that thing we talked about way long time ago? Yeah. It's a steady flow of things, just to like keep it not scary, because it's not supposed to be scary. And you kind of also said it, parents get super used to having someone in their house. And I'm fading another patient, not the one we just talked about, but the parent was like, yeah, we've been using this as a crutch. We're ready. We needed the push. The other thing I found super helpful is I make sure I believe in what I'm saying. And if I can convey that confidence and that belief, it puts parents at ease much more. Because if I go in there with these conversations and I'm like, oh, well, like, we could try this one thing, they're like, okay, so why aren't you doing that? And why are you telling me my kid is done? So really making sure, I believe in what I'm saying. If I don't, I put the conversation off, because if I can't stand solidly on my clinical judgment, I'm not going to push that onto a family.
That makes total sense, Andra. And I'm starting one of these tougher conversations with one of these families who have been in services for, I think, almost 6 years now. And this individual has gone through a plethora of BAs, and I've had them for almost 9 months now. And it's a tricky conversation because you're coming in and you aren't responsible for the previous learning history from some of those previous BAs. And you have to tell parents, like, hey, I know they tried this a year, 2 years ago, 3 years ago, and it wasn't effective then. I tried it now and it still may not be effective. And that's really hard for parents. And I think for me, that's also really hard to say, I would love to try these things if we were 3 years ago, if we were earlier in interventions or younger in age, because now, this client that I have is almost 12 years old and is using an AAC device, but is not great at the AAC device, doesn't have a lot of those foundation skills. And so I've been trying to kind of plant those seeds with parents of, we need to prioritize. Is it speech? Is it OT? Is it DSPD? Because behavior-wise, I don't know what else to do. And that's a challenge. And getting parents buy-in and understanding has also been a challenge. So being a part of this and hearing how you have had those conversations and how you've helped Juliet have those conversations is really awesome to hear. And now I know I'm coming to you next week for a conversation for some help with this. But it's fading and ending services can be a nightmare for some parents, and we have to make sure that we are as understanding and open to supporting them in all of the other outlets that we're trying.
One of the things that I caught on to, Andra, that you were saying that may be helpful for you as well, Carrie, is that coordination of care. Not just to say, oh, I connected once with a speech therapist, but actually taking the time to meet, bring in the parent, talk through those honest conversations. This is what we've done. This is what we've tried. These are the areas we have been successful. And how do you see, with this transition, you can support in these areas, and then they can speak from their expertise.
Yes, I've been doing a lot of collaborating with speech, especially the last 3-4 months, and we have revamped the device and changed icon sizes and the number of buttons per page, and kind of prioritized 1 to 2 word mans on one screen rather than trying to have him click one button to go to one page to go to one thing, and you're not getting the functionality of the communication. So collaborating has been really, really beneficial.
I think when you do hit that collaboration too, for parents, at least my experience, it shows, I didn't put this FADE plan into motion and I'm just going to sit back and let it ride. You are putting in the effort. And I think it can get a little dicey because I felt this way with this FADE, that parent hadn't really let me in to these other sessions, and now they are. So it felt a little bit icky to me that I'm like, oh yeah, I'm putting in this ton of effort now, but just really showing like, hey, I'm still committed to this, even if we're finishing up, versus, yeah, I'll see you in a couple weeks. It's fine. Just making sure. Yes, engagement.
For success after we're gone. And I've had a conversation with another family that I am implementing a FADE plan for. And the parent, when we were talking the other day, said, you've given us a lot of tools the last year of services that we feel we can now handle these situations better. And we can handle that day to day. And I was like, that's a win. That is, the parent training has paid off. The ABA services have paid off, and the parent said, if this is everyday life now, I can handle it.
Are there any kind of final tips or advice you would give other behavior analysts who are going through FADE plans or planning to initiate?
I kind of already touched on it, and I just kind of wanted to encompass ethics into it. Some of these things, like, I just felt not good about doing anymore. So sticking to that too, ethically, what am I doing? But then conveying that confidence to the parent, I think that's just hands down probably been my biggest asset, that I believe in this. I know you guys can do this. Let's, part ways, let's move forward. But yeah, ultimately it's just, I believe in this clinical decision, and being able to pass that to the family is what my biggest piece is.
I think at the end of the day, when you know you have provided the most effective treatment possible, you have explored beyond the areas that you know how to do, reaching out to colleagues for more support when, I've done XYZ, I've been trained to do, but I see the literature tells me there's these other options. Is that something appropriate? Get that training. And at the end of the day, you've exhausted everything possible. I think it does help your decision making. It is hard, I think, though, as a behavior analyst to know I've done everything and you want to do more. But sometimes that more is helping them get to that next step. Well, thank you all so much for joining today. It was really, really wonderful hearing all your great, advice for others and your successes and your plans for success. Thank you.
Thank you.
Thank you so much.